Good day, Ma'am Rose, Kakilia. I am Marjorie M. De Rosa from BSN 1A, and in this video, I'll be performing the general appearance and mental health status procedure.
Come in.
Good day, Ms. De Rosa.
Good day.
Alright, so I am Marjorie M. De Rosa, and I am a student nurse in here. And later, when I come back, I will be asking my name to you.
I remember.
Alright, so before we start anything, I would like to inform you that I will be assessing your general appearance and your mental status. So before we start anything, I will be washing my hands first. Is that alright with you?
Yes, that's alright.
Alright, just wait. I will just come back. Hi again, Ms. De Rosa.
Hi, Nurse Marg.
Oh, you remember. That's good. So, before we start your general appearance proper, I'll be asking you a series of questions first. Is that alright with you?
Yes.
Alright, so, do you perhaps smoke?
No.
No, alright. So, do you chew on tobacco?
No.
Alright. Do you have a regular or daily consumption of alcohol?
No.
No, alright, that's good. So, do you know any of bumps or lumps in your head, in your face, or in your body that I should know of?
No.
No, okay, that's good. So, we'll be starting our assessment in a few, alright?
Alright.
Alright. Right, for the general appearance, we are gonna be first observing the patient's height, the weight, and the body build according to the patient's age, lifestyle, and health. So, as we can see, she's in perfect health and perfect shape for her age and lifestyle. So she is good with that. Next we want to do is to observe her posture while sitting down. See, she has good posture. She's sitting upright. And ma'am, can you please stand up? Alright, so we're going to be checking the posture when she's standing up. She stands up straight, no any imbalances. And ma'am, can you please walk a little? Alright, she maintains a good posture. Go back, please. Sit down. Alright, that's good. She has good posture with that, and so she's good. So next will be the overall hygiene and grooming, and now we can see that she's tidy. She looks very clean, very hygienic, so that is good. Next is the breath and body odor. She smells fine to me, and even though with a mask, she still smells fine. So that's good to know. Now we observe for any signs of distress or any stress, or in the face expression or the posture. She's not sluggish. She maintains an upright posture, and she's good with that. No any signs of distress. Now any signs of illnesses or health problems. She's not feverish. She's not sweating or anything. She's good with that. Now we assess the client's attitude. She's very good at listening. She's very good at answering my questions. She's very responsive. She's very kind. All right. Now we note the patient's mood. She seems happy right now.
Yes.
Yeah, she seems very happy today. So that is good to know. Now we listen for the quality and quantity and organization of speech. She's very responsive, and she answers very well with the questions, and she follows the propers orderly. Now, also the relevance and the organization of thoughts. I think she's thinking well with how she answers based on how she speaks and answers my questions and my orders. So that is very good. Also, for the we have to look for any assistive devices in her body, attached to her body, that may be present. So we find nothing, so that is very good. So once we find all the findings, we are going to be recording them or documenting them. We're going to be assessing the client's skin. So the first thing we need to observe or inspect is the client's skin color. She has a good light brown to brown color. As you can see, she's a morena. She's a very nice skin color for a Filipina. So now next is to inspect the uniformity of the skin color. Is there any discoloration in the other parts of the body? No, there is none. Ma'am, can I have his head? As we can see, there is none. So that is good. So now we're gonna be assessing for the edema. This is the any swelling that is in the body of the clients and the tissues. So that is where like the fluid is trapped in a tissue of the body. So we don't see any swelling. Ma'am, can I see? Yep, we don't see any swelling, so that is good. So if you do see one, please make sure to wear gloves to inspect and palpate the edema. So next is to inspect, palpate, and describe any skin lesions. We don't see anything in the patient's body. Ma'am, can I see your hands first? So I see here. Okay. We don't find any. So if you do find one, wear gloves if the lesions are open and draining. So it would be not infected. So next will be to observe the skin, observe and palpate the skin moisture. Ma'am, can I get your hand again? Let's see the other one, please. So that is all good. She has good moisture in her skin, not too dry, not too wet, like not too moisture. So next is to palpate the skin's temperature. Here. Okay. She has a good temperature in her body. She's not too hot, not too cold. She's just alright. So now next is to compare both feet and 2 hands of the patients. Ma'am, can I please get your hand? Alright. To check that they are symmetrical and they have the same features. So we observe for any differences. Alright, so we don't find anything. So that is good. So now note the skin sugar. This is the elasticity of the skin. So ma'am, can I have your hand again, please? So I'll be pinching a little, right? But it won't hurt. I'll just be pulling a little. Okay. Okay, you found the elasticity for the hands. Now for the collarbone. Alright. She has good skin sugar or skin elasticity. So that's good. So now, after we find anything, we're going to be documenting the findings. And if you saw any lesions in the skin, so draw that in your chart. So you would know the location for it. So now we are going to be assessing the client's hair. So ma'am, for this process, I'll be touching your hair. Is that alright with you?
Yes.
Alright. So the first thing that we're going to be doing is inspect the the client's rather, hair thickness and even growth. So in here we see that it's growing pretty even. We don't see any bald spots in her head and her scalp. So that is good. So we also inspect the thickness and the thinness of the hair. So as we can see, she has a very thin hair, but it is not fragile. So that is good. So now we're going to be inspecting the hair texture and the oiliness of the skin. So as we can see here, she has a very dry hair, and it's a bit frizzy, but some of the spots are smooth also. So for the oiliness, it is commonly seen here near the scalp. So as you can see, she has a dry scalp, so that is good. Dry, but it's a bit moisturized as well, so it's not that dry. We don't see any dandruff too, so that is good. So next, we're going to be noting the presence of any infection or infestation by parting the hair. As you can see, it's already parted. We don't see any head lice going around, so that is good. So we can also inspect this in the hairline of the client, and here behind the ears. Can you turn your head a little bit? Ears and the hairline in here going to the neck. So we don't see any infestation, so that is good. So next is the inspect the amount of body hair. Ma'am, can I please put your hand? She has very a good amount of body hair. She has body hair in here, but they're not so thick. They're just fine. In here, she has a lot of volume hair. She has a lot of hair in here, so that is very good. So now we find all the findings. We're going to be documenting them. Next, I'll be assessing the patient's or the client's nails. So, ma'am, before we start, I'll be needing to hold your hand to assess your fingers. Is that all right?
Yes.
All right. So the first thing we need to do is to inspect the fingernail plate in here, in here, in here. So this is to determine the curvature and the angle of the nails. So as you can see in here, she has a pretty flat one. Only a little curvature, but anything abnormal seen. Ma'am, can I see the other one, please? Alright, that is all good. So next we do is to inspect the fingernail and the toenail texture. Ma'am. Alright, so it is smooth. There is no sign of any roughness into them, so that is good to know. Next we check is the bed color of the fingernail and toenail in here. So we don't see any blackness or darkness. That is a good white. So that is good. So next is to inspect the tissue surrounding the nails. So that is good in here. There's no discoloration. So that is good to know. Next is to perform a blanch test on the capillary refill. So to do this, we're going to be applying pressure in here, and release them immediately. Then the thing to know in here is that it is normal if it returns in 2 seconds. If not, it is a failure to do so. We suggest the impaired blood flow to the extremity. So in here, just put a little pressure and release. So the pink appearance came back in 2 seconds, so that is good to know. So we document the findings that we found, and that would be all for the nail assessment. Now, this is the last portion of our general appearance assessment. This is the skull and face assessment. So the first thing we're going to be doing is to inspect the skull, the size and shape and the symmetry of the face and the skull. So we're going to see first, ma'am, can you look here, please? Alright, so as you can see in here, she has a perfect head shape, or the normal head shape for her age and for her body. And for the shape, we're going to be seeing if there's any lumps in here or in here. She has a good and pretty round shaped face. And now for the symmetry of the skull, is there any elevations in here? No, we found nothing, so that is good. She has good symmetry in her face and her scalp rather. So next we're going to be palpating the skull for any nodules or masses or depressions. Ma'am, I'll be touching your skull on your scalp. Is that okay?
Yes.
Alright, so in here. Okay. Alright, we found none, so that is very good. That's good to know. So next we check for the facial features. Ma'am, may I see? Alright. Ma'am, may I put down your mask for a while?
Yes.
Alright, so now we see her facial features here. She has good facial features. She has good muscles. Okay. So that is good. So next is to inspect the eyes in here for any edema or any hollowness. Her eyes fits in her eye socket very well. There's no any hollowness, so that is good. So now we're going to be noting the symmetry of the facial movements. Is there any twitching in here? No, we found none. She's very symmetrical in here. So as you can see in here, she doesn't have any swelling of the face in here or anything, because that could mean stroke if it's not symmetrical. So she has good symmetry. So now we need to ask the client to elevate the eyebrows. Ma'am, can you put your eyebrows a little up in here? Okay, that's good. Now, ma'am, can you frown or do like this, like get angry? Can I see your anger face? Alright, so that is good. So now, next, can you please close your eyes tightly? Tightly, ma'am. Alright, that is good. So now, can you puff your cheeks? Puff your cheeks. Alright, that is good. So now next, can you smile? Can you show your teeth when you smile? Alright, that is good. That's good. So now we're going to be also checking how she can do in resistance. Can you open your mouth? Alright, can you close your mouth? Alright, that is good. So now we document the findings that we found for this procedure. So that concludes the general appearance assessment that we did on our client today. It composed of the skin, nail appearance, the hair, nails. So that is good. We found good results. So thank you, Ms. Rosa, for coming in today.
You're welcome.
Alright, that will be all.